This is the Emergency Medical Minute, sponsored by Health One.
This is kind of a fun one. All right. As opposed to all of the usual lame ones that we do. All right. So I remember when I first started at Swedish, there were two older providers. We'll just refer to them by initials since this might be sent to the world. P, S, and B, M. And these guys they probably actually weren't that old, but they seemed really old when I was a brand new, freshly minted resident. And I remember that Swedish actually used to be a lot busier. And sometimes you'd be running around with your hair on fire and you'd have 12 patients personally. And then you would notice that BM had gone to the lounge, the doctor's lounge, and was gone having lunch for like an hour with the anesthesiologist just hanging out. And then he'd come back and kind of slowly engage in patients. In contrast, a lot of us, it's not uncommon to hear someone say like, oh my gosh, I've been here for 8 hours and I haven't peed and I haven't had anything to drink. So we don't allow ourselves to have these breaks. And so this study is an interesting one from Academic Emergency Medicine in 2020, earlier this year. And they were looking at burnout. And so at a single busy hospital, they took ER nurses, residents, and attending physicians, and they said, okay, we're going to have you take a 5-minute break during your shift, and you're going to do either deliberative coloring, so the little coloring books for 5 minutes, or you're going to play with a dog. We're going to have you do official pet therapy for 5 minutes. And then they had a number of different measurements of what their stress was. So they used 3 different scales. They used a visual analog scale, kind of like the faces that we do for pain. And then they also did another scale called the Modified Perceived Stress scale. And then they took their cortisol levels by a salivary swab. So almost, they enrolled like 122 patients or participants. 5 of them said, oh, I'm too busy, I can't do it, which I thought was ironic that they are giving them a break. And then you got randomized to either hanging out with a dog for 5 minutes or doing the coloring for 5 minutes. So the results were really interesting. Let me just take a look. So the visual analog scale was the same across all of the groups in the beginning, and then it was unchanged at the end of the shift in the controls, and it was decreased for the people who hung out with dogs. Interestingly, it was increased for the people who did coloring. So they were actually more stressed at the end of their shift if they had to do 5 minutes of coloring than if they got to hang out with the dog. And then they did salivary cortisol levels, and for the people who didn't get to do anything, they had a control group. Those cortisol levels were higher, and then they were low in both the therapy group, whether it was drawing or whether it was dogs. And then they also interviewed patients, and patients were like, I can't tell any difference. And, this doctor doesn't seem any less stressed than the other doctors. And so what they concluded, the one interesting finding was that the colorings seemed to be more stressful, like people were more stressed out when they did coloring. And the authors hypothesized it was not a blinded study, and so they think that these people thought that they were going to get to play with the dog, and then they were super disappointed when they had to do coloring instead, and that's why they think they were more stressed. So anyway, the take home from this is not that we should pass out coloring books to everyone, but I think that you really can and should take just a few minutes for yourself during the shift, whether that's actually having something to drink or using the bathroom, or taking 3 minutes to call mom, or just taking a minute to sit down and debrief, especially after a stressful situation. So that's it.
Great. And we'll have puppies delivered at noon.
Yeah, exactly.
I'm calling the shelters.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.